topic of our journal club was Neoadjuvant Nivolumab plus chemotherapy and resectable lung cancer. It is an international phase 3 randomized open label trial that was funded by Bristol Myers Squibb. A phase 3 trial tests the safety of how well a new treatment does versus an old treatment. And an open label trial means that none of the information was withheld from the participants, meaning the researchers and the participants know which treatment they were receiving. And in this study, patients were randomly assigned to receive nivolumab plus platinum-based chemotherapy or chemotherapy along with surgery followed by resection between stages 1B and 3A for non-small cell lung cancer. Nivolumab is a fully human anti-death antibody that can be given as an injectable or an IV to restore the function of anti-tumor T cells. And there are early trials that suggest that surgery is a primary treatment for non-small cell lung cancer, and also that another trial suggests that adding neoadjuvant chemotherapy to surgery improves the outcomes of patients, but only minimally. And outcomes have been suggested to be favorable for non-small cell lung cancer using adjuvant nivolumab, but further studies need to be done. This study is one of the trials that need to be done because the design had to be implemented with the phase 3 trial. And there are two primary endpoints that were coming from this trial, which is event-free survival and pathological complete response. Pathological complete response is the disappearance of all invasive cancer after completion of neoadjuvant chemotherapy. The inclusion criteria for this trial included, it must be consisted of patients with resectable stage 1B to 3A non-small cell lung cancer. And what this means is that their tumor had to be greater than 4 centimeters in size. The exclusion criteria was patients were with known ALK translocations, which is anaplastic lymphoma kinase, an enzyme in the body that's encoded with the ALK gene, or glomerular filtration mutations. And patients could not also have any prior anti-cancer treatments.
So one of the primary endpoints was the event-free survival outcome and also the major pathological responses. Now, the event-free survival outcome means that no events took place, such as progression of the disease, reoccurrence of the disease, or death, occurring from selection to the trial's ending. The secondary endpoints were time to death or distant metastasis, which is a tumor growing outside of the primary tumor, and overall survival. The characteristics by which the data was collected was age, sex, region, disease stage, tumor type, smoking status, and what platinum therapy that they received.
From March 2017 to November 2019, 358 patients were enrolled and assigned to receive neoadjuvant nivolumab plus chemotherapy for a treatment group. For a control group, the second group was chemotherapy alone. The baseline characteristics for these patients were well balanced between the two treatment groups. The patients were randomly assigned in a 1-to-1 ratio to receive a 360 milligram dose of nivolumab plus chemotherapy or to receive chemotherapy alone. These doses were administered in 3 cycles every 3 weeks before the patients were to undergo surgery. For the nivolumab plus chemotherapy group, the event-free survival was 31.6 months with a confidence interval of 30.2 to not reached. In the control chemotherapy group, the event-free survival was 20.8 months with a confidence interval of 14.0 to 26.7. The hazard ratio for disease progression or death was 0.63 with a confidence interval of 0.43 to 0.91 and a p-value of 0.005. The percentage of patients with a pathological complete response in the treatment group was 24% with a confidence interval of 18.0 to 31.0, and 2.2% in the control group with a confidence interval of 0.6 to 5.6. Treatment-related adverse events occurred in 33.5% of the patients in the nivolumab plus chemotherapy group, and in 36.9% of those in the chemotherapy alone group. The addition of nivolumab to neoadjuvant chemotherapy did not increase surgery-related adverse events or impede the possibility of surgery.
A possible weakness with this trial was the Eastern Cooperative Oncology Group's grading scale, in which they graded the patients on how well they were living day to day with the cancer. And their scores were reflective of higher scores means a greater disability. And this was a subjective way to classify a patient's standard of living, because some patients may not have much activity as opposed to the others. We agreed that the author's ending result is correct, considering it does treat the targeted patients and there was no clinical significance in adverse events in both groups. The benefits of this trial do outweigh the risk, in the sense that the treatment group had an increased duration of living with no difference in drawbacks as a result.